And we are live.
Thank you very much. Good afternoon, everybody. It is Thursday, March 11th at 1 p.m. and I'm going to call this meeting of the Public Employees Benefits Program Board to order. If staff would take the roll.
Absolutely. Laura Freed.
Present.
Linda Fox.
Here.
Betsy Aiello is excused. Don Bailey is excused. April Caron.
Here.
Michelle Kelly.
Here.
Jennifer Krupp. Unmute. Jennifer.
I'm here. I had a double unmute.
Tim Lindley.
Present.
Marcia Urban.
Here.
Tom Verducci.
Here.
Thank you. We have a quorum.
Cool. Thank you very much. All right. Agenda item 2 is public comment, and I'll limit this to 3 minutes a person just to keep us moving on a busy afternoon. And I will turn it over to PEB staff.
Okay. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you will be advised that you may now make your comments. If you're calling in via telephone, please press *6 to unmute. As the chair said, due to time considerations, each caller will be limited to 3 minutes. And I'm getting the first caller ready. And I'm trying to get them squared away here. Caller with the last 4 digits of 2121, please slowly state and spell your name for the record. Press *6 to unmute and make your comment. Caller with the last 4 digits of 2121, please press *6 to unmute and make your comment. Okay, we'll come back around to that caller. Caller Brooke Maylath, you may now make your comment.
Thank you. For the record, my name is Brooke Maylath. I'm an employee over at the Department of Public and Behavioral Health. I've seen the estimates for your fiscal notes for SB 139, which I must say are rather fantastic in number. And by that, I mean that the idea that SB 139 would double the cost of what you're currently paying for gender affirming procedures is just that. It's fantastical. It is. It does not bear out in reality. And I would urge that you go back and revisit those numbers to come up with an appropriate fiscal analysis. My history with this goes back with PEB to 2014 when I made the original presentation for inclusion of gender affirming procedures. And at that time, the actuarials were coming up with equally fantastic estimates of it costing the program, $3 to $5 million more than what it had in the past. And I think we can see that that has not, borne into reality, that the current budget is approximately $500,000. The programs that were called out, specifically for SB 139, for treatment of youth. Well, youth are already covered. There may be an individual example once or twice of pulling a surgery up earlier than 18, but for the most part, that is done rarely. And for voice therapy, that is an extremely inexpensive option for the few people that need it. So we're not changing the system. We're still saying that there has to be a pathway to declare medical necessity for any procedure. We're just saying stop discriminating against people that are paying into the system and are deserving of compensation that allows access to medically necessary treatment, just like other people pay into a healthcare system so that they can be able to be treated for medical necessity for their symptoms and their issues. This is simply an equality issue, and your fiscal notes need to address the reality of the situation and not just take a worst case scenario that is filtered through bias and past discriminatory actions. So thank you for your time, and perhaps you'll be available tomorrow morning for the presentation on the bill, as I will. Thank you.
Caller Kent Irvin, you're now unmuted and may make your comment.
Kent Irvin, K-E-N-T-E-R-V-I-N, for the Nevada Faculty Alliance, representing NSHE College and University faculty statewide. Good afternoon, Chair Freed, Executive Director Rich, and board members. Regarding the list of bills that PEB is tracking for today, NFA recommends that the PEB board take a position in support of AB 48, the bill to allow non-state PEB retirees to reinstate PEB coverage once per lifetime, as can state retirees currently. However, we believe that the once in a lifetime re-enrollment provision is unnecessarily restrictive overall. It was added in statute in 2011, and it unfairly restricts retirees who might go into and out of employment or spousal coverage from taking advantage of the best health care plan available to them. With the pre-existing conditions mandate in the Affordable Care Act, adverse selection should not be a problem for reinstatements. Regarding SB 139, the expansion of services in the bill for certified medically necessary gender affirmation procedures, the additional services are modest compared to what PEB already covers. And as noted in the other public comment, we believe the fiscal impact in the staff report is grossly exaggerated, and that needs to be corrected. For SB 171, we share the concerns of our constituents about being required to use mail delivery for prescriptions, both because of porch theft security and the spoilage of drugs needing cold storage, particularly in hot southern Nevada summers. Patients should be able to opt for alternative delivery methods when needed, which might include pickup at a shipping center or pharmacy location. Finally, the Nevada Faculty Alliance is continuing to advocate at the legislature for the restoration of PEB benefits, including the long-term disability or LTD benefit, Medicare retiree HRA contributions, and pre-pandemic employee premiums. We ask that PEB maintain the maximum possible flexibility in restoring these benefits while the legislative budget process progresses, as slow as it may be. And we ask that PEB staff actively engage with the Legislative Council Bureau and the Governor's Finance Office to find solutions. Regarding the LTD benefit specifically, the current contract has not gone out for bid for many years. That was noted in the legislative audit. Given PEB's recent low claims experience, it might actually be much cheaper in the competitive marketplace now than the current contract. Given the continued suppression of claims because of COVID, There is a likely buildup of excess reserves which could be used to continue the current contract at least until an RFP can be done and alternatives can be fully vetted. These items should be agendized for your March 25th meeting. It is unconscionable to merely let employees who may become disabled after July 1st to have no safety net. Thank you.
Caller with the last four digits of 7832, please slowly state and spell your name for the record, and please press *6 to unmute and make your comment.
Thank you and good afternoon. My name for the record is Terry, T-E-R-R-I, last name Laird, L-A-I-R-D. I'm the Executive Director at the Retired Public Employees of Nevada, RPEN. I would just like to echo most of what Kent Urban said previously. We did testify February 26th as well as March 10th on Assembly Bill 48 in support. We want there to be equity between both the state and non-state Medicare exchange participants because, as I testified in the February 26th meeting, we do get lots of phone calls here at the office when one of the retirees have made a mistake and accidentally fell out of the Medicare exchange for something that they thought would be less expensive or perhaps better, or on the recommendation of their doctor in one instance. We just hate to have that happen. So we are definitely in support of AB 48. And as Kent mentioned, in regards to the budget cuts, we're hopeful that those will not happen to long-term disability, as well as the HRA cuts from $13 to $11, and the life insurance, rather, we hope that can remain the same, and if not, down the road, get even better than it is now. So thank you so much.
Caller Amalia Russell, please slowly state and spell your name for the record, unmute and make your comment. Caller Amalia Russell, please slowly state and spell your name for the record and make your comment. All right, we'll come back around. Caller Douglas Unger, please slowly state and spell your name, unmute and make your comment.
Doug Unger, D-O-U-G-U-N-G-E-R, UNLV Chapter President and Southern Nevada Government Affairs Representative, Nevada Faculty Alliance. Though the agenda for this meeting is a legislative update to determine PEB board positions on several bills for the 81st Nevada Legislature, our state's higher education faculty must express once more our severe disappointment in the plan design process and its demoralizing results. We estimate state employees will lose $25 million per year in benefits because of this process. This includes plan designs that increase deductibles and out-of-pocket maximums that will burden the sickest and most vulnerable, an erosion of support for retirees that amounts to a regressive tax, the cleaving in half of our life insurance, and elimination of long-term disability insurance we view as both unnecessary and deliberately cruel to state employees who will suffer an accident or illness that prevents them from working, and especially to the terminally ill. We understand that many of you on the board are not in favor of these mandates from GovRec, nor how this process happened. We insist this does not have to happen, that there are other, less painful solutions. And now consider how tragic and sadly absurd it will be that this slow-moving but no less runaway bureaucratic train of a plan design process meant to save tens of millions from the state budget due to the pandemic economy will probably continue unstoppably, even under what is reported will be a $3.9 billion deluge of cash from the American Rescue Plan that intends to help fix this very crisis. We believe federal rescue funds might help the restoration of benefits to previous levels, or at least mitigations to punishing cuts, given enough flexibility and creativity by PEB, along with our strong petitions to the legislature. Whenever employee advocates raise this possibility, the answer we get is something like, "The cavalry is coming, too bad it's too late to stop the train." This can't be true. The fate of the PEB budget is up to the legislature now and the board. We request the board meet in an emergency session to determine restoration strategies to be shared with employee advocates so we can make the strong case to legislators. For example, the board could ask to delay open enrollment by a month or longer in anticipation of rescue funds. Open enrollment delay has been done before without too much disruption. The board could meanwhile consider how best to repair our plans by restoring long-term disability insurance, retiree contributions, life insurance, and cutting premiums if the high deductibles and out-of-pocket maximums are now too late in the process to revise. This can happen. The money will almost surely be there, thanks to a visionary act of Congress meant to help us all to emerge and recover from this god-awful pandemic. State employees deserve this recovery. We've earned it. Few have worked harder for it, including health professionals and frontline workers risking their lives in this pandemic every day. Health insurance and benefits restorations by PEB will be essential also for our recovery. Thank you.
Madam Chair, the public comment has concluded.
Okay, thank you very much. And for anybody who didn't get a chance or is joining us late, there is always a second comment period at the end of the meeting. So with that, we will go to agenda item 3, discussion and possible action regarding legislature bills that might impact PEB during the 2021 session. And that is really the focus of this meeting, is to talk about bills pending before the legislature. So with that, I will turn it over to Executive Officer Rich.
Thank you and good afternoon. Please excuse my voice. I promise it's not COVID. I have a cold that I got from 2 9-year-old twins who went back to school. So, the first thing I do want to bring up here is that there are plenty more bills that we're looking at. Unfortunately, a lot of the language came out within the last 3 or 4 days. And we have been flooded with bills that we're looking at. And so, but because of open meeting laws, and Ms. Mooneyhan can back me on this, we have to stick to the ones that are in this report. So I'm hoping to update this report, and for our March 25th meeting, we'll have another agenda item with another update with some of these bills that have come out recently that, that need to be brought to the board. So with that, we will start with 82, which is basically this bill is regarding boards. If some of you recall, we had this situation happen to PEB actually not too long ago, where we had a board member, at the time it was Dr. Packham, who had he was asked to be on the Patient Protection Commission and had to resign his role at PEB because he could not be on 2 boards at the same time per statute. So this is essentially what is being fixed in this bill, is to it's to remove that that rule. I don't know if this really affects us as a program. This definitely affects the PEB board. For those of you who are, so eager to get on other boards, and PEB doesn't take up all your time, this would definitely open the doors to that. So there is no impact really to the program. This does affect the board as far as giving board members the ability to be on other governor appointed boards. I don't know if the board wants to really take a position on this. There definitely is no fiscal note. It was presented to the Assembly Committee Government Affairs and Senate Government Affairs on February 15th, but it has not been heard since then. So, and I think what I'm going to do is stop at each bill and we can discuss it if that's okay. So I'll just stop there.
Okay. Board members, do you have questions for Ms. Rich or wish to share any comments in your capacity as board members who might want to serve on another board besides the PEB board?
Well, yeah, Tom Verducci for the record. You know, I have seen this as kind of a restriction here that we want the most qualified person to be on a board. And if they're serving in another capacity and it restricts them from being on two boards, I think this is a very good thing. We lost Dr. Packham. I've seen it on another board. And I think just merely because they're on two boards really is not a justifiable reason for them not be able to provide the public service. So I'm actually happy to see this bill going through. It doesn't look like there's any fiscal impact to the program, and looks like a good thing that's happening there. I think from being on these calls in the past, this would normally be a neutral position since it does not have a huge impact on PEB. That concludes my comments there.
Thank you, Mr. Verducci. This is Laura Freed for the record. I would agree. I mean, we don't have to, board members, we don't have to take a position on any one of these things, except of course the bills that we ourselves sponsored. So we can just, we don't need to take a motion to support, oppose, or be neutral. And I would agree with Mr. Verducci's comments that this helps individuals who might seek positions on other boards, but it neither helps nor harms PEB as an organization. So I feel neutral about this one myself.
And for the record, Laura Rich, Chair Freed, maybe you can clarify this, but in my experience, usually state agencies typically don't get up in opposition or in either way. It's usually a neutral stance. However, we can provide testimony to to further the explanation as to why we
Right.
where we stand, but typically it would always be in a neutral position.
This is Laura Freed. That is absolutely correct. Historically, yes, agencies offer testimony in the neutral position as subject matter experts and might approach the sponsors or other stakeholders in a given bill to explain where, in this case, PEB would be coming from. But in this case, I mean, PEB doesn't need to come from any particular position on Assembly Bill 2. So.
Okay, so if there is no further comment on that one, I will move on to AB 39. This bill revises provisions relating to public records. It is a public safety bill. Existing law requires that all public records be available to the public during office hours. Basically, what this bill does is it defines what a public record is. And what does that mean? It's all recorded information made or received in connection with the transaction of public business. I think this bill really applies to any state agency, where I think every state agency is probably looking at this and tracking this. I don't see this as affecting PEB any differently than it did, than it does today. We are obviously subject to public records request and will abide by those, at any time. So, I don't see any issues here with this one. It was, it looks like it has not been presented yet. So we're just kind of watching it at this point.
Thank you. Board members, any questions about this one?
Yeah, Tom Verducci for the record. Do we see any fiscal impact here in terms of additional costs with the records? It's not real clear in the notes I'm reading at here.
For the record, Laura Rich, no, I don't think that this is going to impact, that we're not going to place a fiscal note on this. It's, we are subject to public records requests. And so we follow those accordingly. We don't anticipate a major cost to that. Some of these public records are more work than others, but there's requirements attached to each of the public record requests that comes in.
Thank you very much, Executive Officer Rich. And I don't think there's any position we really should take there unless there's something I'm overlooking. So.
This is Laura Freed. I would agree with that. This somewhat narrows the definition of public record, but it doesn't change the fact that all of us are subject to public records requests, and the public records law itself doesn't change that much. So this is another one I think that the board can safely remain neutral on.
Okay, so moving on to Assembly Bill 48. This is the PEB bill. I presented on this on February 26th. I presented the bill, and there was a work session on it yesterday. There were no questions that came up during that work session. However, during the presentation, one of the requests that the committee made was the fiscal impact on local government. So we know that it does not have a fiscal impact on, and let me back up just for those board members who are not aware of what AB 48 is. It was the bill that the PEB board produced to fix the non-state Medicare retiree situation. So the non-state Medicare retirees today do not have a one-shot chance to come back, sort of like the state retirees do. So for example, if a Medicare retiree is on the Medicare exchange and they are approached by another plan, let's say an AARP plan or senior plus care plan or something like that, they are then asked, they say hey, we can save you $10 on this plan if you move. And so they're like, great, that's $10 that we can save. I will enroll in this new plan. And what happens is they enroll directly with the carrier and not through the Medicare exchange. And so they are no longer on PEB. And so when that happens, they terminate and they lose their HRA benefits, their life insurance, basically every long-term benefit that they have worked for. In the case of a state retiree, the statute specifically gives them one period of time where they are not covered, but they are, that does not apply for the non-state retirees. So that being said, the committee had asked for the impact on the non-state or on the local governments. And so thankfully, Carrie and all of the accounting staff, they went through and put the hours and hours worth of effort to go through each one of those potential terminated members, and there were over 1,000 of them, and figured out where they came from, how many years of service, the average years of service, and we were able to put together an estimated impact. So we did produce that, and I think that there was some concern from those certain committee members who thought that there might be a potential impact to the local governments, and they had some concerns with that. So there were some no votes, but it did pass committee.
Okay, this is Laura Freed. So just to recap, Assembly Bill 48 received a due pass out of Assembly Government Affairs yesterday, goes to the full assembly. I do not see any fiscal notes placed on this bill by local governments. And again, I mean, LCB staff is pretty judicious about sending it out to everybody who might be affected by a bill. And of course, every stakeholder has the ability to put on an unsolicited fiscal note. So was there any testimony from the locals that this would have an impact, or was this something that came straight from the government affairs members themselves?
So Laura Rich, for the record, there was no testimony. These were questions that came from the committee members themselves.
I see.
And quite honestly, I don't know if these local governments have been following close enough to even understand what is happening. I mean, the only public testimony besides, RPEN and some of the regular followers of PEB, there was some public testimony, and it was, thank you for letting retirees come back on and opening the floodgates, which obviously was not, it was an incorrect. That is not what we're doing here. We're not doing that in this bill. This is only allowing those that have been terminated to come back, that giving them that one-time opportunity.
Okay, Laura Freed for the record again. This is, board members, this is our own bill, which not all of you obviously were here last year when we voted to put this forth as a BDR to the governor's office, and then it was subsequently approved and then approved for drafting. So in that sense, I would like the board to take a position on this one. This to me is a fairness bill, that giving the retirees, the Medicare retirees who make a mistake by not using the exchange officially, giving them one shot the same way that actives would have one shot to come back as retirees, or former actives, I guess I should say more precisely. So with that, other questions for Ms. Rich from the board?
Well, it's Tom Verducci again for the record, and I wanted to point out that I work on another plan with the county here in Nevada, and I ran into the situation just the other day where someone at age 65 went on the exchange, and she really regretted it. She had to give up her HSA contributions and was understanding about it. But this is really our bill. It pertains to PEB, and once in a lifetime could be a bit restrictive, as we heard in the public testimony. But I think this is our bill. I think we should be supportive by all means. And that's my comment.
Okay. Everybody's so quiet today.
So what, Tom Verducci again, and sorry to keep chiming in here, but I think as we go through these, this should be one that really, I think the board would really want to support, and I think this is going to provide relief to a situation that's been around for a long time, and we needed a legislative change to make it occur. So I am all for supporting AB 48.
Well, if that's a motion, I'll second it, Mr. Verducci.
Yes, so moved, Chair Freed. Is a motion.
Seconded. Okay, so the motion before the board is to express its support for Assembly Bill 48. It's been moved and seconded. All in favor signify by saying aye, or wave your hand in your little box.
Aye.
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 Any opposed say no? Great, motion carries. Thanks, guys. All right, let's move on to, I think, Assembly Bill 178.
All right, Laura Rich for the record. So Assembly Bill 178 This bill requires an insurer to take certain actions relating to the acquisition of prescription drugs for an insured who resides in an area for which a declared disaster or state of emergency is in effect. So, when I read this, the first thing I did actually was thank you, Miss Fox, Vice Chair Fox, who is a pharmacist. She reminded me that this was already in effect, and this was actually a regulation or an emergency regulation that was passed early on to just adjust for the accommodate for the pandemic situation that we were in. So what it does is it waives restrictions on the time period which a prescription may be refilled during a state of emergency. There is no fiscal impact on this. There's basically no plan rules are waived. So all the plan rules are applied appropriately. So in these cases, there would not be any fiscal impact to the program should someone receive their prescription ahead of time. So this bill it has not been presented yet, but because there's, we don't see any concerns with that. There's no fiscal impact. This has been going on since the emergency regulation was passed, and this has already been in effect really, and it was just to codify it. So I think that, it's something we're watching, but it is not something we're super concerned about at this time.
Thank you for that. Board members, questions, comments?
All right, so I think we can move on to AB 181. So Assembly Bill 181, it revises provisions relating to mental health. Really, the only effect that this has on PEB is that we are required to submit a report to the Division of Insurance, so to the Commissioner of the Division of Insurance. There's some other parts of this bill that proposes some changes to facilities and the regulation of providers and things like that. But as far as PEB is concerned, the only thing that really affects it is the requirement to produce a report that includes information relating to mental health treatments for each health benefit plan that provides coverage to residents in Nevada. We asked our vendors, and it does not look like this report it's going to come at no cost. And so again, we do not have a fiscal note on this. I think it's a pretty easy requirement to meet. The bill was presented on March 8th to the Assembly Health and Human Services Committee. Again, it's something we're watching, but it's not something that we are very concerned about at this time.
Okay, Laura Freed for the record. Board members, questions, comments? Okay, so just to clarify, you're going to have the vendors do this at no cost to PEB. It's not a staff duty if this bill passes.
Yeah, correct. This would be a vendor. We don't have access to claims, and so this would be a vendor responsibility.
Understood. Thank you.
Okay, so Senate Bill 40. This is a bill that was brought forth by the Patient Protection Commission. It basically establishes an all-payer claims database. And so this is, and I've spoken to the executive director of the PPC about this and have been working with her on it. The goal is to move towards establishing a cost transparency database in our state. This is something that lots of states are doing right now. This is a lot of states are moving towards this model to better understand healthcare and the cost of healthcare, and move towards that cost transparency that I think everybody is looking for. And so what this does, SB 40 really establishes the the regulations behind establishing that all payer claims database. So PEB, I do not feel personally that there's going to be a fiscal impact on this, because we are in the fortunate situation that we are going out to bid for the vendors that would be supplying this information. And so we can easily put this in a solicitation as a requirement of these vendors, that they must produce a claims file that is shared with the, whether it's DHHS or the Patient Protection Commission, however it's established, that it is shared with that all payer claims database, whoever is managing that. So in the past, I know last session we did, the reason that we have put in a cannot be determined fiscal note is because in the past, we did actually ask our pharmacy benefit manager and our third-party administrator for a cost analysis, how much this would cost the program to initiate. The cost at the time 2 years ago was $100,000. And I think that's quite high. I think we can actually do this at no cost moving forward, but that is why we put a cannot be determined, because we need to understand what the requirements are of the system requirements, right? So if it's a very simple claims dump, then in the file layout is a fairly standard file layout that the all payers database is requesting. That's going to be fairly easy, and that's probably a requirement we could just put in the solicitation and hold these vendors to. However, if it gets a lot more complex and somehow, there's a lot more work that is necessary on the vendor's behalf to meet these requirements, then there's probably going to be some costs associated with it. So this would need to, because this is a medical and pharmacy as well as dental claims database, we'd need all the claims to come in. And so we would obviously need our third-party administrator and our pharmacy benefit manager to produce files for both of those. So I will stop there for questions.
Wow. Okay, this is Laura Freed. I noticed, okay, so if we weren't going out to bid and weren't in the position of putting this in the requirements document in an RFP, we would have our vendors all estimate programming and data migration costs, right? And that seems like it would be quite a bit more than the $100,000 estimated a couple of years ago. Because I noticed that Medicaid put a really hefty fiscal note on this one. And I was wondering, I'm gonna have to sit with that one. I'm sorry, this is not really a question. It's sort of, I understand why you put it cannot be determined, but okay, I guess my question then is, what have the discussions been that you've had with the Patient Protection Commission, and are there any amendments in the offing for this bill that you're aware of?
For the record, Laura Rich. So the discussion I had was, what are the requirements? Because it's fairly easy for us to get a claims dump. It really is, and it's not de-identified claims dump is not going to be costly.
Okay.
It's how they receive that. What are the requirements? So that's where it all lands. Is depends on what those requirements are. Do they need a direct feed? Is this something that they just put on an FTP site? How is this data collected? And so, obviously, those requirements have not been established yet, and it's way too early in the process. They really don't want to there's not a desire to codify this and to, get into the nitty gritty and,
Right.
into, they don't want to put that into statute because then it
Sure,
limits
no, that's
them.
not necessarily where it belongs. I would
Right.
concur with that, but in order to cost it out, you're absolutely right. We need to know, essentially, what do you want us to do?
Right. So that's what it all depends on is, if you want a claim stump, that's easy. And that's probably not very costly at all, if anything. We can get a claim stump fairly simple. But it's how do they want to receive it and what format and how do they need it? And are there going to need to be system requirements, things like that.
Chairperson Freed, I have a question.
Sure, go ahead, Ms. Kelly.
So I work in finance, and we do have a standard format, for finance files, executive officer Rich. So I'm just wondering, is there a standard format for this health information, for the claims information that's kind of out there? Is there something that we can recommend putting forward, I guess?
So for the record, Laura Rich, yes, this is something that we actually, that I spoke to the executive director of the PPC about. Nevada is not trailblazing here. There's other states that have already taken steps to establish this or have an all-payer database established. So there's already systems in place, and there's already other states who have been doing it. There's already, there are standards set already. And so the expectation is that whoever in Nevada, whatever vendor that Nevada gets, will also have very similar standards on these, file requirements. And so this is obviously something that they're going to go out to RFP for and will include. So it's not something that it's something that's being considered, but they want to stay away from, putting the requirements or any kind of language about that in statute.
Thank you.
Yeah, I'm Tom Verducci for the record. I had a question for Executive Officer Rich. As far as the required database cost of $100,000, am I reading this correctly that that's going to be paid by the vendors, or is that a cost to PEB?
For the record, Laura Rich, that would be a cost to PEB. So this is something outside of the scope of the contract that we have today. And usually if there's any other reporting or, required reporting that vendors, that we ask vendors to do, there usually is a cost that is tacked onto it. Now this 100,000 it came up last session, so we used the same amount. It was the same, basically the same bill. Again, it's when we don't know what the requirements are, you have to plan for the worst, I guess. But like I said, if the requirements are, here's a claim stump, that's easy. And that's probably going to cost nothing. It's just when it gets more complex and you start establishing, the requirements of the vendor to receive that data and how they need the data. And if it's, if it has to be in a certain format and you've got to, make system changes and things like that, that's where you get those costs that come in. So we can't determine that until those requirements are in.
So therefore, the $100,000, that would be something that we did not really previously budget for. And so, if that's the case, where does that 100,000 actually come from? Do we just build into it in the next cycle, or how's it paid?
So Laura Rich, for the record, that's why we're in a fortunate situation where we are actually going out to bid on these contracts. And so we can make them a requirement in the RFP. And so I already have a note to myself that, this is something that we need to make sure to capture in the solicitations to, so we don't overlook it.
Therefore, after the solicitation process, this 100,000 would be shifted from PEB then to the successful provider that's bidding in. Is that correct?
it would be incorporated as part of their proposal, and I would assume it would be built into the overall costs that they are proposing in their cost proposal.
Wonderful. Thank you for helping me understand that. I wasn't sure.
This is Laura Freed. Well, going to be interesting to watch this one roll out. Thank you. I guess we can move on to the next one.
All right, so the next one is Senate Bill 139. This is the one that we heard a little bit of public comment about. It requires certain health insurance to cover the treatment of certain conditions regarding or relating to gender dysphoria. You know, there's a couple things on this bill. So PEB already covers, we provide a lot of these benefits already. We provide this coverage. I think one of my staff can correct me if I'm wrong, but I think we put it into place in like 2015, where, you know, we cover a lot of these benefits, but this adds the requirement that PEB provide these benefits or extend these benefits to those under age 18, and also currently cover the benefit of voice therapy, which is, you know, is not currently covered today. So, you know, I know that there was some discussion about the fiscal note. We worked with our vendors quite closely on this and looked at, you know, what could be the cost of extending the coverage to those under 18 based on the current claims that are in our system today and the history, the trend history of the claims we have seen over the last few years. These types of claims have been steadily rising. I actually reached out to some of the vendors and asked the question of, you know, is this type of benefit typically covered in the private sector? And the answer was no. And so there could be the argument that people come and work for the state specifically for this type of coverage. And so that is why there's potentially the potential for a higher cost to the program. Now, I do know that I have been working with some other agencies, and I do know that there is an amendment in place that's probably going to be proposed that would it would eliminate the voice therapy and reduce the age to 17. So while ours is coverage at 18, I believe that and I haven't seen the amendment, this is only, you know, what I've heard, that the amendment changes it to 17. And so we would likely, if that amendment is proposed, then we would likely remove that fiscal note, because I don't see it becoming, you know, it would not affect PEB at that point. You know, changing it from 18 to 17 is not going to make a big difference. So we would likely remove our fiscal note on this. So this bill has not been presented yet. And obviously we are watching this closely. I am working with, again, like I said, some, you know, other agencies that are also watching this and working together to ensure that we can come up with appropriate language for this amendment.
Marcia Urban for the record. I was talking to a friend of mine about this, and he thought that the 500,000 was extremely high. The voice therapy, he said, is not that expensive, and neither one of them are. So my question is this estimate a good estimate, or is it a very high estimate? I'm questioning it.
So the estimate, Laura Rich for the record, the estimate is, we have to rely on our third-party administrator. They look at, you know, they look at the claims. They look at who is in process. We also have included our utilization management vendor as well. There's typically case management that goes along with these types of services. We have enlisted, all of the collaborative support and discussion between all of these vendors. And it is an estimate because, again, we don't know, opening the doors to under 18, what does that do? What does that do for the plan? Is there going to be a high incidence of under 18 seeking these services? Is there, possibly, is there going to be a more frequent occurrence of people seeking this type of coverage, right? Again, like I said, this is not widely offered in the private sector. This is not a benefit that is offered very frequently, very commonly in the private sector. And so you do get you have the possibility or probability of people coming to work for the state just to get this coverage. So there's taking all those things into account and seeing how those claims have grown through the years. That's where that figure came. Whether it is a good estimate, PEB has to rely on the experts for this. And this is why we have these vendors to provide this information and their expertise.
This is Laura Freed. I have a question just for my own clarification. So in the various chapters being amended by this bill, it specifies coverage must include without limitation coverage of medically necessary psychosocial and surgical intervention and other medically necessary treatment for such disorders provided by endocrinologists, pediatric endocrinologists, social workers, psychiatrists, psychologists, voice therapists, gynecologists, plastic surgeons, and any other providers of medically necessary services for the treatment of gender dysphoria, gender incongruence, and other disorders of sexual development. So in that list of A through H, the ones that PEB currently doesn't cover are basically voice therapists. Okay, and so the sort of actuarial guess comes from the reassignment. So in other words, the services provided by all the other specialists named in the bill for folks under the age of 18. Is that right?
That is correct.
Okay, got it. Okay. And I noticed, again, looking in Nellis, and for the court reporter's benefit, Nellis is the Nevada Electronic Legislative Information Service, Nellis. It's where we find all the bills information. I noticed there's no fiscal notes in Nellis, and I have a hard time thinking that there might be, other fiscal notes, like perhaps from Medicaid, for instance. When is your fiscal note due? Is it still in process by the LCB?
It is. It's already due, and
okay.
we've already submitted it, and it is still in process.
Okay. All right. Thank you. Board members, other questions?
Chairperson Freed, I just have a quick question for the executive officer.
Okay.
Executive Officer Rich, it says certain health insurance. Can you, you've referenced a couple of times that there's some concern that people would leave private enterprise jobs to come to state employment. That's probably a good thing. But my actual question is, who does this, what entities does this bill apply to, if not private enterprise?
So for the record, this bill applies specifically to, for the state, it would be Medicaid and PEB.
Thank you.
This is Laura Freed. Well, hearing no more discussion on Senate Bill 139. I guess we can move to Senate Bill 171.
All right, last one. Laura Rich for the record. Senate Bill 171 prohibits a pharmacy benefit manager from requiring a covered person to obtain a drug by mail. So currently, this really applies to specialty medications. In terms of PEB, PEB uses Express Scripts, who uses Accredo for their specialty med pharmacy. Typically, with those specialty meds, there is a mail order requirement. This would remove that mail order requirement and allow those folks to fill at retail or use that mail order if they choose to do that. Obviously, there's going to be a fiscal note, and it's not in this report. However, about an hour before this board meeting, I actually spoke to the folks at ESI who have been working on coming together with a potential impact of this bill, and they were able to unofficially tell me that the fiscal impact will be about $318,000, is expected to be about $318,000 annually, which is quite honestly much less than I was expecting, because when you fill at retail, the discounts and the rebates are much lower than those discounts and rebates that the exclusive specialty pharmacy would provide us. And so my thought was that the fiscal impact would have been a lot higher. So I was pleased to see that. I think the thought behind this is that those who are currently using the specialty pharmacy are happy with it. This is what they do. This is how they've been used to it. They get very individual service and personalized service from the specialty pharmacy. Those moving forward in the future might choose to fill at retail instead of that pharmacy. And so you're going to see in the future people move towards that. But those who are already using the specialty pharmacy are probably going to stick with the specialty pharmacy. So the fiscal impact is not quite as high as I think PEB staff were expecting. And it does provide some choice to members. And like you heard a public comment that there is some concern with mail order, and especially in the South, where it's very, very hot during the summer, and things can medications can be affected if they're sitting on your doorstep for a couple hours. So it does come at a cost, but I think you're also bringing forth some options to members.
Marcia Urban for the record. I think in the past year, we have seen how difficult sometimes getting mail is. Many of us have been home for some of those months so that we were able to get it. But I had packages from mail, from FedEx, from UPS. All of them had changed, and they continue to change. The recent weather on the East Coast and the Midwest had changed things. So I think this is a good thing, because we can't always rely on it. And giving people that option when you have a specialty medication is extremely important, and especially something that has to be at a set temperature. I'm lucky I don't have to take any of that, so I don't have to worry. But for those who do, I think they should have the option to be able to go out to a retail outfit.
Well, Tom Verducci for the record. We heard testimony on porch theft and spoilage of drugs, and I think we want to make prescriptions as easy as we can available to the membership. And if, there's not a huge fiscal impact on the program, so be it. Let's, make access where we can to the prescriptions that our members need. I still think this is a no position bill in terms of the direction, that the board should take. But I do think wherever we can make it more flexible for our members to get their prescriptions and get them to them in a safe manner that works for them is going to be good for everybody. And that's my comment there.
This is Laura Freed. Any other comments or questions, board members? I see Mr. Lindley shaking his head. Nope, I'm good. All right. Well, with that, we have, I think, finished agenda item number 3, and we can return to the second public comment period under agenda item 4.
For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you will be advised that you may make your comments. If you're calling in via telephone, please press *6 to unmute. Due to time considerations, each caller will be limited to 3 minutes. Caller with the last 4 digits of 7338. Please slowly state and spell your name for the record. Please press *6 to unmute.
Good afternoon to the board and Chair Freed. This is Priscilla Maloney, PRISCILLA-MALONEY. Can you all hear me properly?
And
Great. I wanted to apologize. I wanted to jump on in the beginning just to echo the comments that were made by Dr. Irvin, Dr. Unger, and Ms. Laird as members of our Public Employee Coalition that we often support each other's positions in our comments. I would like to inform the board, though, that at the initial opening screen, the public dial-in number was correct, but they had a different, and I'm looking right at it now, it's the one I'm using, but there was a different number. So this is something maybe for broadcasting for the meeting ID. So going forward on YouTube, on the YouTube channel, just be aware that that's why I wasn't there in the beginning. But I'm here now. So thank you for all the comments and energy around these positions. It does sound like the only particular bill that today is having a formal position sort of recorded for the PEB board, and that's AB 48. And again, like Dr. Irvin and Dr. Unger and Ms. Laird said, we all testified in support of AB 48, and as it moves through each house, we will be continuing to do that. But thank you for all your time and energy putting together this helpful sheet that helps us with our bill tracking activities as well. So thank you.
Caller with the last 4 digits of 7832. Please slowly state and spell your name for the record. Please remember to press *6 to unmute. Caller with the last 4 digits of 8673. Please slowly state and spell your name for the record, and please press *6 to unmute.
Hello, my name is Brooke Malaf, calling in again in reference to SB 139. A few minutes ago, Ms. Rich gave representation that SB 139 only applies to PEB and to Medicaid. That is not true. I can't understand why this bias is being publicly displayed, that there is a fear of transgender people coming to state employment just to be able to get a medical benefit. That can be a very positive thing because we have many, many skills and assets that can be able to contribute to our state government. But note that the bill affects every single type of health plan and health coverage in the entire state, including private employment and even privately purchased insurance. So there is no motivational factor of having these benefits in the state plan versus any other plan. But it does represent this unprovoked fear that these benefits are a bad thing. So I suggest that we look very, very closely at how we are treating transgender employees that are currently in the employ of the state, and making sure that they are not being harmed by this kind of displayed bias. So I thank you for your time, and please, I ask the board to closely examine the effects of discrimination and bias as evidenced in today's hearing. Thank you.
Caller Amalia Russell, please slowly state and spell your name for the record, and be sure to unmute. Caller with the last four digits, 7832. Please slowly state and spell your name for the record and press *6 to unmute. Madam Chair, that concludes the public comment.
Okay, thank you very much. And with that, I will just say thank you, board members, for your time this afternoon. This was our shortest meeting in memory, but brace yourselves, my friends. Our next meeting is March 25th, and it is a big one, so get ready. It's going to probably be a fat meeting packet too, so I look forward to seeing that from the PEB staff. And at 2:13 p.m., I will adjourn the meeting. Thanks, everybody.